I'm gonna check my physician's order, make sure this is the correct patient, and it is. This the right patient. Make sure it's the correct medication, and it is. I'm giving 60 milligrams furosemide IV push, and I'm giving it over 3 minutes. I'm also gonna make sure that my patient is not allergic to anything, and my patient is not. Okay. Okay. I'm also gonna take my medication to the MAR. Furosemide 60 milligrams, furosemide 60 milligrams. That is correct. Okay. I'm gonna make sure that that's a safe dose, and 60 milligrams is correct. It's a safe dose. The fluids that are hanging is compatible because my book says that it can be diluted with normal saline. So normal saline is correct. Okay. Also, the rate of administration, the book says 1 to 2 minutes, but it says 40 milligrams or a fraction thereof should be given in 1 to 2 minutes. But I'm giving 60 milligrams, therefore I'm going to give it over 3 minutes. Okay. Some levels we should make sure to check would be potassium level, because this is furosemide that we are giving. Okay. Some other precautions that we should take: we should monitor blood pressure frequently. We should also monitor for electrolyte imbalance. Monitor for signs and symptoms of fluid or electrolyte imbalance, like I said: arrhythmia, drowsiness, dryness of the mouth, hypotension, lethargy, muscle cramps, fatigue, or weakness. Okay. Now I'm going to assemble my equipment. Okay. I have everything that I need. I'm going to perform hand hygiene. Okay, perform hand hygiene. And I'm going to go ahead and put my gloves on. I don't know if it matters, but I let them touch the counter. So I'll just get some more. Not let them touch the counter. Okay. These gloves are too small, but the only thing we had to work with, so try. Okay, so I got them all. Now I'm gonna clean my valve for 15 seconds. Alright. These gloves are, let me see. Okay. Have my syringe and my needle. Put that on. Put this stuff on. Okay. Now. That's not right. Take this off. Come on. I cannot get that to come on. Okay, I got it. All right. Okay. Oops. Excuse me, I'm doing it over the trash can just because it's a little extra. Okay, and that is 6 milliliters. Okay. This back on. Now I'm going to label my medication. I'm going to label it with the medication amount, which is 60 milligrams furosemide, and I'm also gonna make sure I have the patient's name on here. So medication, patient name, and a dosage. Okay. So now I'm going to go into my patient's room. Hey, my name is Erica Altman, and I will be your nurse today, and I will be administering furosemide IV push, 60 milligrams. Okay? Can you tell me your name and date of birth for me? They would tell me their name and date of birth. I would check, make sure that's correct. That's the 2 identifiers. I would also ask the patient, are they allergic to anything? And they told me no, which is correct. This is what the Moore also said. Okay? Now I'm gonna wash my hands again. And I'm gonna apply gloves. And just because I'm thinking about it and I can't remember if I said it, also with the medication, make sure to check the potassium level, because this is Lasix that we're getting, furosemide. Okay. Now I'm going to lower this, make sure that it's on the count. Okay. And lower it to make sure that it's functioning. Also, I would assess the IV site and make sure that it's still intact, no redness or no draining. So let's see it. Okay. Okay. I need another pause up. Now I can get ready to administer my medication. I'm going to use the port that's closest to the patient, and I'm going to clean it for 15 seconds. Okay. I will be giving this medication over 3 minutes. So I'm gonna go ahead and connect it. Okay. Make sure that you can see it. Go ahead and I'm gonna clamp it here. Okay, I'm gonna count my medication here, not there. It would be here. Okay. And now I'm giving 6 mLs over 3 minutes, so I would give 2 ml each minute. Okay. 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 Now I'm going to release it. I'll put this in a sharps container. I'm going to see how my patients tolerated the medication, make sure that they have no complaints or anything that we previously talked about, like blood pressure, any signs of weakness, etc. And that completes my procedure.